I self-identify as a woman of color. Specifically, I am of Asian Indian descent and have been in this country for most of my life. I was born in India and I came when I was just under 2 years old.
Okay. And you are a child and adolescent psychiatrist.
I am a child and adolescent psychiatrist. I love being a child, adolescent, adult psychiatrist, and I think I will make this point several times during this conversation. It has given me the opportunity to really have different careers and different opportunities. So right now, I'm a full-time Chief Diversity, Equity, and Inclusion Officer at MD Anderson. I've been in this role since May 31st. And previous to this, as you know, I was the inaugural Chief Diversity Officer at the American College of Cardiology, and previous to that, the Director of Diversity and Health Equity at the American Psychiatric Association. And I certainly credit my professional background and my experiences that are about 20 years of being a child, adolescent, and adult psychiatrist to my work today. In fact, it has laid the foundation for the diversity, equity, and inclusion work that I am honored to be leading in my current role, but also in my previous roles. I was in the Midwest. I was in Michigan for medical school, in Detroit. I think an incredibly diverse city, one that I thank so much for so many different aspects of my personal growth, but also my professional growth. When I was in Michigan, I remember thinking, and this was the late 80s when I was in medical school, psychiatry was not a popular field, and certainly not child psychiatry. In fact, most people didn't know what I was talking about when I mentioned some interest in child psychiatry. And I still was debating between, I think, pediatrics
Mhm.
and child psychiatry. I had so many people that I could meet in the pediatric space, but actually, a lot of my pediatrician mentors were the ones that talked about the importance of child psychiatry and how this was going to be a field that would be expanding and growing. And I was so fortunate to have so many pediatrician role models who talked about the role of a child psychiatrist really getting to know their patients more to a different degree, even than themselves as pediatricians. I would be working with not only families, but communities, school settings, there were so many contexts which were so important to kids, and that being a child psychiatrist would really allow me to get to understand the patient or the person I was working with in so many different contexts and be really able to help all the other people in the child's lives. And that was really appealing to me.
Mhm.
I think the other part that was really appealing, and I saw this with my primary care mentors, so in pediatrics, my family doctors, and they all saw that psychiatry was potentially an area that, of course, actually, Amatine, you and I know very well now, would allow you to understand sort of the other diversity dimensions
Mhm.
of a patient, that was so much a part of the bread and butter of the work that we were doing, so that you naturally had conversations with people about how race would impact or how race impacted their mental health, their confidence, how it was playing out in their day-to-day life. It was part of the conversation, it was integral to the conversation. Same thing with their gender status or sexuality, religion, spirituality, all of these things and dimensions of people, which back then, I mean, now today we talk about it much more and it's a great thing. But back then, people didn't ask you those kinds of things. And yet in psychiatry and mental health, and particularly child psychiatry and child mental health, that was part of what you did. You really wanted to understand the patient and help them holistically. So in order to do that, you really had to understand all the different components of a human being. So I'm still very involved in APA. I mean, as you know, I was at the American Psychiatric Association for about 4.5 years, not only as the deputy medical director and director of diversity and health equity, but I had the honor of leading the APA and APA Foundation fellowships, the SAMHSA funded fellowships, which were under the larger umbrella at the time of the Minority Fellowship Program, have been part of the APA, gosh, for like 45, 50 years.
Mhm.
And so that has quite a network, I think, of young and now mid-career, more senior child, child, adolescent, adult psychiatrist, public psychiatrist, cultural psychiatrist. And I've continued to mentor, and I think now have many deep friendships with people who are involved in that program. So I'm always pulled back to APA because of that. It's a great opportunity. I try not to miss the meetings. It's one of the things that I think you know very well too, that we pay it forward in this world. I have had incredible mentors and sponsors who have always gone beyond, um, expectations for me, and that has really been a model for me. And so I frequently get asked by not only people in their residency, but also people who like being in medical school contemplating psychiatry, or even sometimes college students who want to co-present, or they invite me to their presentations, and I never want to say no to that. That's really important to folks. And so I get pulled into APA more. I am a member of ACAP as well. And actually, I would say that's how I met you, which is definitely a plus. It is hard to be very involved, I'd say, in two organizations. So I know this is not quite with your question here about involvement in ACAP and APA. I find it, for me anyway, being more involved in a substantial way in one organization and staying a member of other organizations is good, but I find myself really probably focusing more with my heart and soul in one organization. It just helps me balance my life than other things as well.
Right. And that's important for us to let our mentees know. Other folks that we've interviewed have said the same thing, that they're a member of two or three. And then there's also the education organizations, ADPERT and ADAMSEP. There are research organizations. There's the Black Psychiatrists of America. So people are choosing which ones they want to spend most of their time in. But I think you're speaking to the fact also that all of these organizations are making a difference in allowing us to serve as mentors, in allowing us to have an impact on the practice of our specialty. And
Absolutely. So I think you make a good point, Dominique. It doesn't, we pick an organization, there's so many pick memberships in several, and then decide which one resonates, and you're not stuck with that. You could also try other organizations. I mean, I'm a member of GAP and ACAP and APA, and I find myself doing more for APA, but all of these are incredible organizations, and I'm not even mentioning all of them. You mentioned even more. So I think you don't have to worry if you become a psychiatrist, if you're going to have networks. I mean, the networks are unbelievable. We're kind of a special group as child psychiatrists. We take the work with our patients and families and communities, and we apply those same concepts in other parts of our life. I find that in some ways, the sense of community building is so incredibly important to child psychiatrists, which you would expect, and it actually is true.
right. And for those who don't know, GAP is the group for the advancement of psychiatry, right?
That's correct.
Okay, great.
Thank you. I will tell you the first one that really appealed to me, and I think has been sort of my North Star. Just the possibilities with child psychiatry. I think that's what so many people said to me. What you learn as a child psychiatrist is so applicable in so many different ways. I mean, you learn about systems, learn about how people, when you interface with them, you're thinking about them as a person, and they're also part of a context, multiple contexts, families, a school system or a community, a church, place of worship. I mean, just in so many different ways, civic groups. And so to think about people is much more complex. And certainly I think child psychiatry has given me so many skills to think about things that way. So where I work with teens quite a bit in terms of the work I'm doing, and most of my work is sort of part of the business function, those same skills easily are transported into the work that I'm doing. I would say the other sort of maybe sound bites or anecdotes that I can share that really appeal to me about being a child and adolescent psychiatrist. Somebody once said to me, being a child adolescent psychiatrist is synonymous with being a cultural psychiatrist. And I think for me, the most appealing piece, and again, I started my road in child psychiatry many, many years ago, and I think more and more people are seeing this, you can't be a child and adolescent psychiatrist without being a cultural psychiatrist. They are completely synonymous. And I remember one of my first jobs was working at a college mental health setting,
Mhm.
which I think is kind of a watershed of what America is or will be like. And if you really want to know what America's going to be like, go to college campuses. I was struck. I remember during my time there were very few adolescent child psychiatrists there. First of all, it's mostly adult psychiatrists.
Mhm.
And understanding development, I think, is really critical to anything. I mean, in some ways, I remember one of my supervisors saying every psychiatrist should learn how to be a child psychiatrist first and then an adult psychiatrist because he thought development was so critical. One of the answers has been that we're teaching our adult psychiatry residents more about development. But going back to the anecdote, it was interesting at this college mental health setting how many people wanted to see me. And I thought to myself, well, but who am I? There were all these wonderful child psychiatrists here. I mean, albeit more adult psychiatrists, but there were all these other people. Why do they want me? And I found out that it's because the rapidly changing racial ethnic dynamics on college campuses, the more interest people had in accessing mental health and wanting people who may have similar backgrounds to them. So I had so many people, students coming to me and saying, the reason you have a long wait list is because I don't know what your background is, but you were not white
Okay.
or you were a woman. And I just thought you might have a background or something that you could relate to my experiences. I would reframe the non white to, do we have more people in child psychiatry can really mirror the patients that we're seeing, the communities that we're seeing more and more of,
Mhm.
so that we can really get to optimum access. People want to know that they can share experiences. Now, we know that after you build a relationship, transference happens and all these other things. But it's interesting that first contact with patients, oftentimes they want to know if you could potentially relate. And it sounded like a lot of these college students were saying, we wanted somebody who might have some idea of what I'm talking about when I say that I'm experiencing microaggressions, or I feel like I'm the only one in this setting,
Yeah.
that I don't have parents who speak English, or I'm the first in college. Um, I don't have legacy or generational wealth. I mean, there was all these things that were being ascribed to me, true or false, but it all came from a picture that they saw and something different than what they had seen a psychiatrist look like. And you and I've seen this you're on med Twitter and social media. This is the face of cardiology. This is the face of psychiatry. It's gender focused and also people of different backgrounds because we want to send a message to the next generations, but also our patients and communities. There are people who look like you, and certainly all of us, in the medical community can work with you. And if it's important to you to have somebody who is similar in background to you, we can help you find that. And you and I know that in child psychiatry and psychiatry, probably more than any other field, we ask patients, do you want to work with us? Is it resonating for you? And I think that may get back to some of these other questions of, do you have similar experiences? If I had to do this all over again years ago, I'd do it all over again. And the field is just expanding and it's exploding. When I started in psychiatry, people thought one of the main modalities of treatment was therapy, and it is still, thankfully. And we can't even just say therapy. We could spend all day talking about the different types of therapy. So it's expanded psychodynamics, cognitive behavioral. I mean, there's so many different types of therapy. There's also individual and family. And so there's so many, we've gotten so sophisticated in that space. There's also a medical aspect. And so it's really expanding and exploding, I would like to say, even more rapidly than any other field. The other interesting thing, and this has, I think, been more recently, how much more we are regarded by other specialties. I don't think that was the case when we started. And today now, it seems to me that every single person across specialties, and you started by saying, I have worked in other specialties. I'm working predominantly with various specialties that touch around cancer care, was in cardiology before. But everyone says to me, you should go a psychiatrist. You should meet a psychiatrist because they're understanding how important mental health is. And we have finally, I think, done a really good job with our research, with our studies, really with a lot of our advocacy, talking about you really don't have total health if you don't have mental health. And I think people are really understanding the gravity of that. So it puts us in center stage with other types of medical specialties. I mean, you know this, Dr. Almatine. We used to hear this from some of our more minoritized groups. Why don't they pick a specialty that's a minority when they've already spent their entire life being minoritized? Why not pick a field that has sort of more of a ump to it? Well, I will say now, psychiatry, and particularly child psychiatry, it has finally found its position in the House of Medicine. And people are really appreciating and valuing mental health. They understand its relationship to total health. Um, so I think it makes it, for lack of a better word, a more prestigious specialty than I think was previously um, understood. I think things are so much better now than they were back then. And it's not just in psychiatry, I think in medicine at large, there's just a more of an awareness around the need for a diverse workforce in healthcare. I mean, certainly the bread and butter of what I do today, and I understand it very differently today. And I'm thrilled there are leaders and champions throughout the country and the world who are really stressing that this part is important. I would say that when I started off in medicine, it was a very daunting specialty. I'm the first generation in medicine, so it was very scary to think about being a physician. I oftentimes wondered whether I'd make it to med school, I would be successful. And now I think people may still have those feelings, but there are more networks available. There's more opportunities for people to talk about this. And I've mentioned the Minority Fellowship Program at APA before, because I think one of the biggest things that that program did is it really provides this larger community and family people that you can lean in on, not just professionally, but personally. I can't tell you how many times we talked about imposter syndrome, about anxiety, about being a person of color, for, again, all these diversity dimensions, first person in medicine, and really being there to be supportive and opportunities along the way. I've leaned in. I mean, you and I have co-written a book together. I mean, I leaned in on my minority colleagues when I was thinking about a textbook or even the ideas around a textbook, that I really feel that certainly I have a network broader, and my colleagues who are minority backgrounds are probably my first group of people that I go to when I'm with challenges or looking for opportunities. I'm looking for support. It's just it's hard to put it all in words. I just wish I had had all this years ago. I would encourage your viewers to really tap into this. I know you know a lot about ACAP, and I'm sure somebody will talk about all the opportunities at ACAP. But APA actually has opportunities not even just for residents and fellows, but again, people who are medical students and younger. If you want to test the waters about psychiatry, and certainly coming to our meetings is a great way to figure out if child psychiatry is for you. Mentorship is critical. And I think one of the things that national organizations really provide you is a wider access. One of the things I heard over and over again is people would say, I'm the only one of the background in my training program. And it was really the opportunities when I connected them to ACAP or APA or some other national organization that they started to build their networks and their opportunities for mentorship. And I think that's really, really important. Sometimes, in fact, one of my huge mentors who, Dr. Almatine, you've heard me talk about, Dr. Chester Pierce, used to always talk about the value of having mentors outside of your organization. As we know that mentors within organizations, part of their job is to help you succeed within that organization. And sometimes it might be valuable for you to lead that organization. And that's where an outside mentor can really, without having any conflicts of interest, really show you that there might be other opportunities if that is what is best for you. And let's not undervalue peer mentors. I mean, that is so incredibly valuable. They may have more time, they're part of the same potential developmental stage that you are, can relate a little bit differently. Again, opportunities like the APA fellowships, but just coming to meetings, you just naturally meet people. I can't tell you how many people have told me they've come to a talk that I've given, and somebody junior is on a panel with me, and they go up to a person and they say, "Can I be on a panel with you?" And then they watch me pay it forward, and it was like, "Yes, let's put an abstract together and work on something." And so, just even having the courage to come up to somebody and say, "I really enjoy your talk. Is there a way that I can work on a project in the future?" I think people would be pleasantly surprised that more people would say yes rather than no. So what I enjoy the most about clinical work and DNI work is probably similar. It's people. I mean, I think both of them are very people-oriented fields. I think with child psychiatry, certainly I knew you're dealing with the person, but you're dealing with all the people in the child's lives. And it's such a wonderful opportunity to really, at a deeper level, get to know people. I mean, you're trying to bring people together to help this one person, the child or the adolescent in your office. And in that process, you get to hear a little bit more about all the other people and their journeys through childhood and adolescence. And I think that makes it really special. My DE&I work is also very people focused. I mean, I think people will say more and more that DE&I practitioners have to have good interpersonal relationships. They have to understand how to deal with people from different backgrounds. I think leaning in and up and down and around is something that I learned from my work as a child psychiatrist. We talk so much about really building connections. And we've all had these moments when you just like you don't connect. You go back to supervisors, your peer supervisors later in life, and you're always trying to figure out how do you really deeply connect. That same concept is so true in DE&I. People come from different backgrounds and different persuasions. And the goal is to bring everybody on board. I mean, I know you've heard me say this before, Dr. on the team, but the work in DE&I is nonpartisan. It's really for everybody. If we're going to get to full inclusion, everybody has to be a believer. And so you are really stretching your skill set and you're really having to lean in harder on conversations or with people that you may not naturally connect with. And I think that I'd leaned it on my psychiatry skills on that. How do you really have tough conversations? How do you make more conversations transparent? How do you listen to people who think that may not buy into DE&I or buy into what it is that you're doing? And you talked about stigma. Same thing in mental health. You're having conversations, trying to get people to really talk about what's important to them. It's, remember, DE&I work in mental health is sort of almost synonymous to people's personas, right? So part of the stigma comes from, are you attacking who I am? Not understanding that the mental illness is what we're talking about. The same thing is with DE&I and starting hard to have tough conversations. I have found because people will say, if I am, whatever, a Republican, are you saying that that is that? No, we're not trying to pass judgment on people's persuasions or anything about them, but having them actually do the opposite, bring it in and bring it into the conversation and have respectful discussion so that we can all move forward. So there's a lot of overlap with diversity, equity, and inclusion, belonging, and social justice work that I do, and child psychiatry. And so not surprisingly, a lot of people in my role are child psychiatrists or psychologists. I'm just seeing a rapid number of people with our background in mental health and psychology and psychiatry really gravitating to diversity, equity, and inclusion. And also presidents and CEOs looking to people with my background to apply for these roles. So I think everybody's road is unique. As much as we try to send a message that you've got to do 4 years of college and then you have to go to medical school and pick a residency and you have to know really early on what it is that you want to be. I don't think that's true. I think medicine, when we go back to thinking about what are the big components, there's definitely a scientific piece to it and science piece to it. And then that whole artistic piece, which is sort of vague, I would add that to your experiences and having experiences in your life. The more experiences you have, I think the more you'll be able to relate with your patients. I always say don't ignore your inner child. If a part of you says do this, then explore it. And again, tap into your networks and your families. My road to psychiatry was not direct, and certainly my road to diversity, equity, and inclusion wasn't direct. And yet, I can now look back and say that I really sort of leveraged all the different experiences, and I'm thankful for all of those experiences that have brought me to this place. I will say I loved living abroad. I actually don't like traveling as much as I like actually living in different countries.
Okay.
And a very early experience was living in Japan as a high school exchange student.
Hmm.
It's funny. I tell the story every once in a while, and people always, um, finding it somewhat funny. I had studied French through middle school and high school, and then I had this opportunity to be a high school exchange student through the American Field Service. And my parents had always instilled upon my sisters and me the importance of appreciating other cultures and learning and loving other people. And so this opportunity was perfect timing, and I wanted to go to a French-speaking country. I was ecstatic when I got the envelope that said I'd been accepted for this cultural exchange, and then some disappointed it wasn't a French-speaking country, and I'd been placed in Japan. And my parents, on the other hand, were just ecstatic for me. They wanted to spend hours with me to learn about this completely different experience. I knew nothing about Japan or the culture. And then I thought, oh my gosh, on top of that, they placed me outside of Tokyo, where most people were in Tokyo, so that more people were speaking English and they would have this larger American network. I was placed in a small city up north with Japanese speaking host parents, two younger brothers. I had two sisters at home. My host parents were practicing Buddhist. My parents are Hindu. And then they wanted me to go to an all girls Catholic high school where I had to wear a school uniform 6 days a week. So I told my mother a couple weeks into the experience, I said, I obviously was very homesick. I didn't understand language. I was struggling. And she listened patiently, and she applied all her cultural intelligence and said, look, we want you to embrace all these religions. We didn't say that you had to be a Hindu. We want you to learn about other religions, other cultures, be curious, be respectful. And by the right way, Rana, you need to try harder. I tell that experience because it really, I think, set me down a course that has led me here. It was hard work, culture shock, being immersed in something totally different from a language and religion perspective, being so far away from my parents and really being curious and open-minded and respectful. I mean, these are basic tenets to medicine, child psychiatry, DE&I work. And you learn that you find more similarities, and the differences you see are things that you start to embrace. It taught me how to really ask and be inquisitive and do it in a way that's authentic and real, and how important it is to try harder sometimes or lean in more, like I said earlier. It's like psychiatry really teaches you those skills. I mean, it's interesting that some of the things I think we get in our residency and our training really could benefit all specialties in medicine, I think.
True.
So I'll go back to this idea of finding your own pathway. And remember, nothing is a mistake. Everything is part of your journey. So let's be less focused on the destination and just allowing yourself to have as many experiences as possible. Build your networks along the way, build friendships along the way. And there are so many people here ready to help you in any way. I truly believe it just takes you asking, and you'll be pleasantly surprised that there will be somebody who will not only respond, but may actually give you a helping hand.